God, that's no big deal. Most women don't even feel them.
Okay, no uterus, no opinion.
Hello everyone, this is Neha here and my topic for today is the menstrual cycle. So let us begin with what exactly the menstrual cycle means. The menstrual cycle refers to the regular changes that occurs in the ovaries and the endometrium that makes reproduction possible. Endometrium is the layer of the tissue lining the inside of the uterus that consists of functional layer that is subjected to hormonal changes and is shed during menstruation. We will see when does the cycle begin as the female reaches early adolescence as a part of puberty, that is between the age group of 12 to 14 years is referred as menarche, the onset of first menstrual period. Following menarche, the cycle reoccurs on a monthly basis, pausing only during pregnancy. Until the female reaches menopause, that is after the age group of 45 years. This is when her ovarian function declines. The monthly menstrual cycle can vary between 20 to 35 days, but on an average it is of 28 days. Of the total 28-day cycle, the days between 1 to 5 days is termed as menstruation, while the 14th day is termed as ovulation. This is when the ovule is released from the ovary. We will look into that a bit later. The whole of the menstrual cycle is controlled by the hypothalamus and the pituitary gland situated in the midbrain. They can also be called as the masterminds of reproduction. The pituitary gland is made up of two lobes, anterior pituitary lobe and the posterior pituitary lobe. The hypothalamus secretes hormone called as gonadotrophin releasing hormone or the GnRH, which regulates the release of follicular stimulating hormone or the FSH and the luteinizing hormone or the LH from the anterior pituitary lobe. These hormones are released by the anterior pituitary through the blood portal into the female ovaries where the female eggs are produced. Now, let us take a look inside an ovary. This is how an ovary looks from the inside. Inside an ovary, there are various number of blood vessels through which the hormones enter. Also, there are many follicles, and each month only some of the follicles will mature, but only one follicle further matures and becomes an ovule. These lie waiting for the woman's whole life from birth until the month they become active. At the start of menstrual cycle, the follicular stimulating hormone stimulates 15 to 20 of these follicles to start developing within the ovary. As they develop, the cells surrounding them, called the theca cells and the granulosa cells. The granulosa cells secrete huge amount of steroid sex hormones called as the estrogen. Talking about hormones, there are four main hormones released during the menstrual cycle: the follicular stimulating hormone, the LH, the estrogen, and the progesterone. Before we begin, let us take a look at the changes of hormone concentration that come from the brain. As we know, it is a 28-day cycle. Therefore, the y-axis represents the hormonal levels. The x-axis represents the number of days. To make it more simple, the menstrual cycle can be divided into two phases. Ovulation, or the release of oocyte from the ovary, usually occurs on the 14th day, which is the first day of menstruation. Hence, we can consider the 14th day as the halfway point. Therefore, the first 14 days is considered as the pre-ovulatory phase, corresponds to follicular phase or proliferative phase. Similarly, the last 14 days following ovulation is referred to as the post-ovulatory phase, corresponding secretory phase or the luteal phase. So, getting back to our graph, initially there is an increase in the gonadotrophin releasing hormone by the hypothalamus. The frequency of this hormone determines how much the LH and FSH will be secreted. Coming back to our ovary, what we saw was FSH will initially stimulate the maturation of the primary follicles into the secondary follicles. While this maturation takes place, the granulosa cells will produce estrogen. The estrogen has many effects in the first 10 days of the menstrual cycle. In the beginning, it has a negative feedback on the pituitary, inhibiting the release of LH. This is why we can see a steady level of LH in the bloodstream. Even though the GnRH is doing its work properly, it is because of the estrogen, which is why we can see a steady level. Another fact is that FSH is secreted primarily by the estrogen. That is why here also we can see that the FSH level falls down. But what happens after the 10 days? The estrogen levels will continue to rise as the follicles continue to mature, and as the number of follicles continue to mature, the estrogen produces a positive feedback on the pituitary. And we know that low concentration of estrogen inhibits LH, whereas the high concentration stimulates LH. And now, because of this concentration of LH, we can see a massive spike in the LH. Because of this massive spike of the LH, on the 14th day, the most mature follicle is released, and this is called as the female egg or the oocyte. After ovulation, the LH will drop back down to its normal level, hence the GnRH will also slowly drop following it. The FSH also had a little spike as a side effect of LH surge. Hence, we come to a point that LH triggers ovulation and the oocyte is released. Now, after ovulation, it is turned into a corpus luteum, which is basically a dead follicle. Hence, the first 14 days are called as the follicular phase because all it has to do is with the follicles and maturation. To the last 14 days, which is called as the secretory or the luteal phase, because now we have the corpus luteum, which slowly degrades and secretes various hormones. The hormones secreted by the corpus luteum are estrogen, inhibin, and progesterone. But what exactly is the purpose of these hormones? Well, inhibin has a negative effect on the anterior pituitary lobe and the progesterone has a negative effect on the hypothalamus. Why does this occur? This is necessary because we need to bring back the LH levels to the normal as we are in the post-ovulatory phase and we do not want more number of follicles to mature. Because of progesterone, the gonadotrophin releasing hormone is also brought to the normal level as it was in the beginning. Hence, because of all these hormones, the LH, FSH and GnRH are brought to the normal level. Yet, the main effect of progesterone is that it will stimulate the endometrial growth. This is the lining that will shed each month if there is no fertilization of the egg by the sperm. But let us assume that there was no fertilization because it was a normal menstrual cycle. And now, all good things have to come to an end. So, the corpus luteum degenerates and forms the corpus albicans. And as the corpus luteum degenerates, there is decreased level of progesterone, estrogen and inhibin. Now, this is an opportunity for gonadotrophin releasing hormone to again stimulate and will allow a new menstrual cycle to allow. Also, because of decrease in progesterone and estrogen, in part, it means that these hormones can't maintain the endometrial lining in the uterus and causes the weeping of the uterus. Now, this cycle continues again and again, and this is termed as the menstrual cycle. After seeing about the menstrual cycle, let us talk about its most common abnormality. It is the PCOS. 1 in every 5 women suffer through PCOS. PCOS is the polycystic ovarian syndrome. It is caused due to hormonal imbalance leading to enlarged ovaries and cysts on its outer surface. PCOS significantly affects women as the menstrual cycle is wholly dependent on the hormonal balance. The symptoms may include infertility, irregular menstruation, weight gain, anxiety, depression, and sometimes acne problems. Many women have been able to control their symptoms by modifying their lifestyle and dietary choices. These simple tweaks can help you improve your overall health. Here, I would like to conclude my topic. Thank you for watching till the end. Do let me know your thoughts in the comments below.